Welcome back to the Health Longevity Secrets Show with your host, Dr. Robert Lufkin. His book titled Lies I Taught in Medical School is a New York Times bestseller. See the show notes for a link to download a free chapter. And now, please enjoy this week's episode as we look at complex chronic illness with Dr. Eric Gordon.
This week, Dr. Eric Gordon draws back the curtain on chronic complex illness, eliminating the profound yet often overlooked connection between interrupted healing cycles and persistent health problems that conventional medicine really struggles to address. At the heart of conditions like chronic fatigue syndrome, Lyme disease, and atypical autoimmune disorders lies chronic inflammation, not as a symptom, but as the driving force. Dr. Gordon explains that these debilitating conditions manifest when our body fails to complete its natural healing cycle, leaving millions with normal blood tests, but life-altering fatigue, pain, and cognitive dysfunction. The revolutionary, quote, cell danger response framework reveals why your cells get stuck in defensive postures long after threats have passed. Your mitochondria aren't broken, they've adaptively changed their function, which explains why supplements often disappoint chronic illness sufferers. This three-phase healing cycle, which is inflammation, rebuilding, and cellular communication restoration, must complete for true recovery. Yet medicine focuses almost exclusively on just the first phase. So what makes Dr. Gordon's perspective particularly valuable? His recognition that feeling safe is fundamental to healing. The nervous system must receive signals that it's appropriate to divert resources towards restoration rather than just protection. This explains why stress reduction becomes increasingly crucial the longer someone remains ill. In other words, chronic inflammation itself increases anxiety, creating a destructive feedback loop that further impedes recovery. Medicine's blind spot stems from its overwhelming focus on acute care models. We excel at addressing immediate threats like infections or injuries, but pay minimal attention to the complex, individualized healing process that must follow. This cookbook approach fails because biochemical individuality means each person's body responds uniquely to identical interventions. Ready to understand why your chronic symptoms persist despite normal tests? Discover how addressing the complete healing cycle might finally unlock the recovery that's eluded you for years. This episode is brought to you by L-Nutra, maker of the Prolong fasting mimicking diet. If you'd like to try it, use the link in the show notes for 20% off. What's the best imaging test to assess health and longevity? I used to think it was the CT coronary artery calcium score. Well, I don't anymore, because now with the same X-ray exposure and time as a calcium score, I can get a complete metabolic heart scan. This includes not only the CT calcium score, but also calculated arterial age, liver fat quantification, and CT bone mineral density. These key metabolic and cardiovascular markers can detect the actual disease that blood or genetic testing only show the risk for. This scan is available anywhere in the US without a doctor's prescription. See the attached link and use the code LufkinCT for $100 off. Join the health longevity medical imaging revolution today.
And now, please enjoy this week's episode.
Hey, Eric, thanks for joining us.
Thank you. Thank you for having me, Robert. It's a pleasure to be here.
Well, you're an expert in complex chronic illness. So what exactly is that, and what should our audience know about that?
Okay. Well, it's a term that we started using about 20 years ago to explain the people who had been ill for a while, often, and they often thought they had chronic fatigue or Lyme disease or sometimes MS. Or atypical. When I say often atypical autoimmune diseases, which to me all all these diseases, the thing they have in common is that there's chronic inflammation underneath them. And which is the same for basically all the illnesses that you talk about so well, is, the diabetes and heart disease. They're all driven by chronic inflammation. The difference is here is your genes and your environment has created something that now leaves you usually fatigued and in pain, and with brain fog, I guess. So the chronic complex illnesses that we deal with, I think that's kind of the heart of them, is they leave people with their lives unable to be lived fully. That's one of the most important things. So they have fatigue, and they go to their doctor and their thyroid is normal and they're not anemic. And their B12 is normal. Maybe they check that, and after that they're done. Their blood count was normal, their basic chemistries were normal, and these people are told that they're fine. Now, and if the doctor is compassionate, he realized they're not fine. But too often in the past, they would just be sent to a therapist or the psychiatrist, or put on an antidepressant with the idea that you're depressed, because those are also many of them can be symptoms of depression. So what we have realized is that it's always inflammation underneath, and often infection, not always. That infection usually plays a role, some viral trigger. Many years ago, so many people who have mono, I mean, the EBV is a big thing now because of long COVID, but so many people, when they get mono, and especially the ones who got it and were wound up in bed for 2-3 months, and they recover. But then, that's like they're 18 to 20. And then when they're 30 or 40, or after they've had children, or after they've been working too many hours, they start finding that they need to rest on the weekend to catch up, And so that's going down that rabbit hole that can lead to what we call chronic complex illness, where your blood tests are often, your standard blood tests are often normal, but you're still ill. The difference with the autoimmune people is that they have tests that their rheumatologists do that say, oh, you're abnormal, you have this disease, and now they have specific medicines that often can interrupt the inflammatory process in the autoimmune diseases, which is very exciting. But at the end of the day, the thing that conventional medicine has to offer people with this whole strain of, illnesses that don't go away, they get better or worse, is just Band-Aids. Okay.
Yeah,
It's what I
sort of.
call Band-Aid medicine. And we all have to use it. There's nothing wrong with Band-Aids. It's really good when you're bleeding to stop the bleeding. The first step in anything, you got to stop the bleeding. But you then want the healing. And that's what chronic illness is all about. In fact, I probably should have started it. That would have been the clearest thing to say, is that chronic illness is a failure to complete the healing cycle. Okay.
Yeah, that's such an important point. And we've been hearing that it's starting to be a theme in this. In other words, that we can't just treat the symptoms, which is what a lot of Western medicine does for chronic disease, but we've got to get to the root cause. It's sort of like you've got to mop the floor, but unless you fix the roof, you're going to continue mopping the floor all the time. Going back to what you said about inflammation being fundamental at the root of so many of these diseases, as you mentioned, and all, we've been hearing on this program about the role of insulin resistance in driving inflammation. But I guess what you're saying is there's a subset of people that they may not have significant insulin resistance. Maybe those numbers are normal, and there are these other factors that are often overlooked that drive chronic disease and all chronic illness. And what sort of factors are they? I think you hinted at a couple of them there.
Well, I said it's basically your genetics, how your immune system responds to the environment or the stressor. And let me just bring this back to something more basic. is that when you're what this fellow, very smart man who I say he's my patron saint, this fellow Dr. Robert Navio. Okay, and the reason is I had always been amazed by people coming in to see me with shopping bags full of supplements, and still nothing was changing them. These are the people who, I see with these chronic complex illnesses, and they're trying really hard, and they're taking all the antioxidants in the world and all the mitochondrial support stuff, and doesn't do much for a lot of them. Occasionally it helps, but lots of times they're not getting much bang for their buck. And I read a paper of his back in 2013 or something that laid out why. That really the reason that you're fatigued isn't because your mitochondria are sick. Okay, it's because your mitochondria have changed their function as part of their normal functioning. Okay, and that's really the thing. It's not like there are very few true mitochondrial diseases, a few hundred of them, but they're very rare. Okay, almost everybody who's tired, their mitochondria are just doing what they're doing because of the environment that they're living in, because of the metabolites that they're seeing. So, and when I started to understand that, I started to realize why you could give people all the CoQ10 you wanted, and it didn't do much. Okay, because their mitochondria had decided not to listen to it. This whole thing he has labeled the cell danger response. And this is what your body turns on when you get injured or you get an infection. Okay, but it has to go through a cycle that he has broken up into 3 phases called CDR 1, 2, and 3, which we won't go into the details of, but let's say just basically the CDR1 is that acute inflammation. The CDR2 is when your body's rebuilding tissue, and the CDR3, and this is one thing that's very important, is the cells have to learn to communicate again with the ones around them, because just because you build a new liver cell doesn't mean that liver cell is responding to its environment, because one of the things cells do when they get sick is they shut down, they quiet, they just like in the olden days when the castle would be surrounded, they'd burn the crops and retreat into the castle. Well, your cells are doing the same thing. They're trying to, that first stage of CDR1, you have a lot of inflammation being created, okay, and a lot of oxidative stress, and that's on purpose to try to kill the bug. The second stage is you kill the bug, and then you got to, rebuild the tissue. But the third stage, that cell has to begin to respond to the environment again, because that first stage, its membrane becomes less permeable. The membrane structure changes, and the ion channels and the hormone receptors just aren't working as well. Okay. And that's why a lot of people after these illnesses will have prolonged hormonal issues where their blood tests might look like they have enough hormones, but their body isn't acting like it. So that's because some of these cells haven't finished the healing cycle, this healing cycle, and completed and returned to normal. So it's the so inflammation happens when you get stuck in it, when enough of your tissues get stuck in any one of those cycles. Okay, that's the trick. And you don't need your whole body. It's in it at the same time, because we'd probably die if all of our cells were in one of these cycles all at the same time. But parts of ourselves are. So when you talk about diabetes, like the insulin resistance that we see, we're also seeing in the fat cells inflammation. And that's driving the insulin resistance, but it's also creating a lot of inflammatory cells. And when the inflammatory cells are going, they're releasing lots of pro-oxidant things that just keep stressing the system. So it's a round and round cycle of inflammation that I think is really the critical thing here. And the trick is, how do you lower the inflammation? Well, you have to let the body know that it's safe to heal. Okay, because this is the other component of healing that I know you have spoken about many times, and it's so important, is the body has to feel safe. Okay, and we have to do all these chemical stuff, and yes, we need all these interventions that are biochemical or, but either herbal or medical. But we have to also let the brain know, the nervous system know, that it's safe to heal, and that's where a lot of the other modalities come in.
Now, when it's safe to heal, is that related to stress? Is it a matter of avoiding stress and relaxing safety? Is it the mental feeling of safety, or is it something on a mitochondrial or cellular layer, or a little of
Well,
both?
as we say, as above, so below. You need it. You need all of it. I mean, again, I don't want to. There are plenty of people who will stay stressed and anxious and get better.
Mhm.
Okay. So we don't want to make absolutes about this. We don't have to be perfect. That is the beauty of the body. I always tell people I was a mechanic for a short time when I was young, and then you had to do it right. The beauty of medicine is we just got to get close, okay? Because the body is a self-healing organism, but it's until there's at least enough of the message that it's all safe. When you have chronic illness, this becomes more important, okay? Because this is what's so interesting, is when you have an acute disease, you get acute pneumonia, you break an arm, the if you can, like I said, especially with a broken arm, if you get the X-ray and they cast it, and then they take the X-ray a few weeks later and they tell you, oh yes, it's healing, and you relax around that injury. You're not really, I mean, because you have the sense that it's healing, and so all this is happening in the background. But if you have an injury that, like, 6 months later, it's still interfering with your life, it's easy to get too much attention to worrying about that area, and that worry and that stress begins to build over time, depending how much of your life is interfered with. And what we find, that people with chronic inflammation, over time, their anxiety goes up. So even if they're anxious, even if they're calm to begin with, they get a little anxious. If you're by nature more anxious, you can get very anxious because you're wondering what's going to happen with your life, if you're in this state. So what's interesting is that chronic inflammation makes everything worse. So you don't have to be perfect to heal. But I just want to emphasize that. I'm not talking, you don't have to meditate the rest of your life to get well. If you meditate a little bit, it helps. But again, only for some people, because there are some people who, when they meditate, they get more anxious. For those people, they're better off maybe doing Tai Chi, or painting, or using their hands. Anybody, walking in nature, all these things help give us calming signals. And they're important. The sicker you are, the longer you are, the more hard you have to work. If you've only been mildly ill, you can go back to being as neurotic as you want to be, and probably get along. I compare this to, like, having basically a curve in the spine, or your head's forward. There are lots of people whose heads are forward all the time, and you see them at meetings. They're 80 years old and they're like this, and they've been that way for 40, and they're fine. Okay. But I see lots of people who are like that when they're 30, and they're a mess, and this head forward position is stressing their vagal system. Okay. And the tight muscles are not letting their brain drain, and so they have constant head pressure. Now, look, one guy's been doing this for 80 years, the other person's been doing this for only 10. But what's the difference? One of them is inflamed, is chronically inflamed at a bigger level. So they have less room for for not being perfect beings. Okay. When you get, the sicker you get, or the longer you stay ill, often the more you have to pay attention to being healthy. It's just like the patients, many of the people who I know who watch many of the things that you produce are people who are who want to stay healthy. Okay. And they realize in order to really stay robust through their lives, and increase the odds that they're going to be really healthy when they're in their 70s and 80s, they have to work a little harder at it. If they're just going to sit on the couch and, watch television, they might live to 80, but they're going to have trouble getting out of the chair. Okay, so they have to make a choice how much they're going to do. And when you're really ill, you unfortunately usually have to work a bit harder to get well. It's, I wish it wasn't that way, but that seems to be how it works. You have to do the things that would keep you healthy. You have to find the things that would have kept you healthy and do them, but it's hard to do because you don't have the energy. And that's a big issue.
Now, if this chronic condition is at the foundation, chronic inflammation is at the foundation of so many of these chronic illnesses, why is this such a blind spot for our traditional healthcare system? Why aren't they on top of this?
Well, because they had a model that worked. It's the model of acute disease. Okay, acute disease, something happens to you, you get an infection, and if we can kill that infection, your body then heals. Remember, your body still has to do the healing. As we saw, in cancer patients, if they have no white blood cells, it doesn't matter how many antibiotics you gave them, the outcome usually wasn't good. Okay. And it's the same thing. But that was the model of medicine, is acute care. And it's based on warfare, really. I mean, medicine has made the biggest leaps and bounds in the last 100 years because we keep killing each other and we work really hard at fixing the soldiers. And it's amazing, you can get run over by a car now and be mangled, and they can put you back together. I mean, it's really what amazing things we can do. The problem is that medicine hasn't paid attention to this black box of healing. What happens between when we make the intervention and what your body has to do for itself. Okay, so we're really good at removing the stressor, the external, the arrow, if you will. We can pull that out of you, but then you have to heal. We can sew the wound up, but it still has to heal. Okay, and that healing is when that healing is misguided, or when that healing gets stuck in one of those phases of Dr. Navio's 3 stages of the cell danger response. Okay, that's healing. Okay, so that CDR describes the healing cycle. Okay, and if you get stuck in that healing cycle, you then have chronic disease. And medicine has paid little attention to this because we are focused, unfortunately, we have become hyper-focused on, can I find a drug or a single intervention that is going to change somebody? Okay. And that's where all the research money has gone, and because we think like engineers. And engineers do amazing things, but when it comes to biological systems, they don't always get us where we need to go, because they're looking for direct connections that A causes B. Okay, and in the body, A causes 100 things, and 100 things feed back on A. It's a we learn details in medicine. One of the things I love about medicine is I learn one little fact, and then I take that fact and I try to use it to help somebody, But the reality is that it's like when people take supplements or take these days, everybody's probiotics. We have this probiotic that does that one thing, but it's interacting with a system that's then going to do 1,000 or 1,000,000 things. And we just hope that we get the piece that we want out of that, and the other 1,000,000 things that it does kind of doesn't make enough ripples in the pond to really disturb us. But we don't understand at all how this body works. I mean, look at immunology. Every week they're coming up with new new subclasses of, of cells, of T cells, B cells, macrophages. I mean, it's endless. Um, and that's, and so, but we like to simplify things. So we think simply, and we like simple problems. And chronic illness is not a simple problem. And it requires your body to do the healing. And here's the biggest problem. Okay. It's a problem of the individual. When you shoot people with bullets, we all act kind of the same. Okay. And the repairing that process, you can do that on, 1,000 soldiers, and it's going to work probably 990 times, maybe even 1,000 out of 1,000. Okay. You're going to get pretty decent results. Now, when that person has to complete the healing, okay, so you're going to get the blood to stop, you're going to, save the organ, the body, the guy's going to walk out of the hospital, fine. But then talk to them a year later. Out of that 1,000 people, probably several hundred of them still aren't feeling quite right. And they're going to, and even with something simple as a bullet wound, you'll find that they feel differently. They have, some of them, it's going to be a little sore. Some of them, the skin is going to be a little abnormal. Some of them are going to have a reduced range of motion, all with the same injury, because it depends on how their body has reacted to that. Now, that's a simple thing, a bullet wound, relatively. But when you have a more complex interaction, like an infection, or toxins, or even a better example, because some of us have no problems dealing with a tremendous amount of toxins. Our liver, we just have the pathways to get rid of a lot of stuff. And other people don't do well at all with them. So it's their biochemical individuality that comes into play. And so you have all these variables. Medicine has gotten less good at dealing with variables because it's cookbook. You go to your doctor, and they have like 6 to 9 medicines, and out of those 6 to 9, really probably only 4 really different medicines and 6 different variations on the same drug for a problem. High blood pressure, they've got, they're 4 or 5 categories with 6 to 10 medicines in each one, and they'll pick one. And, God forbid you have pain, they have a few classes, and you just work through them. Antidepressants, it's the same thing, but it's all cookbook. And there's very little thinking about your body involved. And the idea of precision medicine is kind of cool, but it's still not going to answer the whole thing, because detail, very large group of things to do. So we need precision medicine. I'm all in favor of that. I think the more details we have, the better it is. But people have to understand there's a gestalt of the human, and that's where the doctor is important. And the doctor used to be so important, because the doctors actually knew people. And that's kind of losing it, because the flavor of who you are as a human being can have a lot to do with what you need to find health, not just to have the absence of something that's making you, not just to make your numbers look better, because that's where medicine is today, is treat the numbers and not that human being in front of you. I'm sorry, we sort of rambled off your subject.
No, that's very, very good. Well, this has been a great conversation. How can people find you, maybe your website and social media, and find out about your practice as well? Maybe you could tell them.
Oh, okay. We're just at gordonmedical.com. I think we probably are on Facebook and Instagram, but I don't pay much attention to social media, I must admit. But that's where we can be found. And, this is the kind of medicine we do. We look at, people talk about root causes, and it's multiple things. I wish there was one root cause when people have become chronically ill. It's multiple. But luckily, you don't have to fix everything, because the body will heal itself. So,
great. Well, thank you so much, Eric, for spending the time with us today. And thanks for all the great work you're doing in this space.
Thank you. A pleasure, Robert. And thank you for your work.
If you are enjoying this program, please hit that subscribe button, or even better, leave a review. Your support makes it possible for us to create the quality programming that we're continually striving for.
Can I start? Is it recording?
It's already recording.
Oh, sorry. This is for general information and educational purposes only, and it's not intended to constitute or substitute for medical advice or counseling, the practice of medicine, or the provision of healthcare, diagnosis, or treatment, or the creation of a physician, patient, or clinical relationship. The use of this information is at their own user's risk. If you find this to be on the value, please hit that like button to subscribe to support the work that we do on this channel. And we take your suggestions and advice very seriously, so please let us know what you'd like to see on this channel. Thanks for watching, and we hope to see you next time. You should say.
That's good. That's pretty good. You like it? You want to do it one more time, or is that good? I think it was good.
You need to save the recording.
Very good.